Hi, everybody. This is Umang over here. Welcome to this platform of Hugging Club of India. I represent the Hugging Club of India. Thanks for being here on a Sunday evening, which you could have decided to be somewhere else. This is a very special event of Hugging Club. We've been meeting for last 5 years, and this is a new initiative with the help of mental health expert. It's called Mental Health Experts Talking About Their Mental Health Challenges. This goes a long way in breaking stigma. People who are here for the very first time, Hugging Club of India is an initiative to remove stigma around mental illness. We started in 2017 because our very close friend Vishal Tandon, he died of suicide. He was 40, his career wasn't going anywhere, and he thought talking about his mental illness, people will think is emotionally immature. And that's the reason he took this step. I'm very closely associated with mental illness because I come from a very different family. My mother had schizophrenia and my dad has bipolar. So I've grown up seeing my mom talking to ghosts and spirits. My father, whenever he got salary, he would not come home. He would go to casinos and gambling houses, and then he would not come, exhaust all his salary and come home. Later, I realized that my mom did not choose schizophrenia. Schizophrenia chose my mom. मेरे पापा बुरे इंसान नहीं है, उन्हें बुरी बीमारी है. It is a mental illness. It is not a character flaw. So equipped with this, we started the Hugging Club of India. We are there in 5 cities now: Bombay, Delhi, Hyderabad, Ahmedabad, and recently Pune. And we have a very active WhatsApp group. So today is a very special day because we are going ahead with this, our new initiative, mental health experts talking about their own mental health challenges. This is a very brave effort by mental health experts who come openly and talk about their mental health challenge, because there is so much taboo, fear of losing respect and credibility. So let me introduce today's guest, Sulbha Subramaniam. Are you there? Can you please unmute and come?
Yeah. I'm very much there. Hi.
Hi. Welcome over here, Sulbha Subramaniam. She's a consulting psychologist for almost 22 years. She specializes, especially help a lot of teens and adults with psychiatric and psychological challenges. She's expert when it comes to parenting, sexuality, personality disorder, anxiety, stress, somebody with low confidence and low self-image. She's trained in REBT and also mindfulness-based psychotherapy. She's in fact does her sessions with trauma-informed psychodynamic approach. She's done her training in disaster management, HIV telecounseling. She's associated with IPH, which is one of the great mental health institution in Thane, and also Shramta. She's a founder member of an NGO called Belief, and she runs a support group called LOC. In fact, she is also was a project coordinator of Maitra, for 23 years, where she was heading this emotional first aid helpline of IPH. And the best thing is, after working with a corporate for 12 years, she decided to give back to the society. And how? This is a third session she's doing with Hugging Club. Her sessions would start at 8 o'clock and end at 12. And the energy would be so same, and she loves traveling. She's passionate about giving back to the society with people, animals, wildlife. In fact, today, this meeting was supposed to be at 5. She had another engagement and I completely forgot. Yes, she was calm and cool. Okay, she rushed from Andheri to here, So thank you so much. Can you please unmute and welcome Sulbha Subramaniam, psychotherapist. Can you give a round of applause, please?
Thank you so much.
Thank you. Thanks for
it's
being
always
over
a
here.
Pleasure being with you all.
Thank you so much. So this is an important segment which we started at mental health, talking about their mental health challenges. And I've seen your YouTube videos and you openly talk about it. My first question is, what makes you do this? Because there is so much energy and to help, and yet there could be a fear of stigma, losing respect. What makes you openly talk about your depression, panic attacks, and ADHD? What drives you?
Okay, so I think first and foremost, what motivates me is that like this awareness and acceptance that I'm human, first of all. Like, I mean, I think like I'm 63, so I've had an experience of being a human being for 63 years, out of which only 25 years is in mental health. So I think I should give that preference, right? So that's one thing. Secondly, if I'm in mental health and I advocate that people should be open and people should not deter, when it comes to taking help, then I have to walk the talk.
Right, right.
How can I like keep on preaching what I don't practice? So that's the first thing. And I feel like the more you are open with it, the earlier you get healed, and then you are a genuine role model, because like the clients see you, the patient sees you, and you have, I mean, not that you got to tell everybody, but it's like when the client sees you and you appropriately disclose sometimes when it is necessary that you've also been through that such emotions, maybe not exactly the same, maybe something else, but you've been through mental health issues, and then they see you handling the session well, they see you handling your demeanor, your emotions, your like behaviors well, handling session well, and they feel like, okay, I mean, it's possible to come out of whatever issues I'm facing and come out well, and this person, having gone through it himself or herself, will definitely be able to understand me better. So I think it's an advantage.
Okay, thank you. Yeah, it makes you, as you rightly said, more human and relatable, that if she can come out, I can also, and inspiration also. And thank
Exactly.
you for practicing what you say, about openly talking and taking help. Thank you. So I want to if you could run down your journey. When was the time when you talk about your two depressive episodes? When
Mm-hmm.
was this and when did you realize that there is something amiss?
All right. So it was like I think the first time about like maybe 15-16 years ago. Um, there was like there were a series of like it's often very chronic, how it builds up. Usually I have very good resilience, very good coping powers, and like of course I have the background, so it helps. I have great friends, so that's like a great support system. But over a period of time I noticed that like my energy was low, and I was very quick to tear up and things like that. That usual enthusiasm, my energy was lacking a bit, and I had to sort of uh, pull myself up for doing the normal ordinary things in life, whereas if you looked at me, otherwise I was okay. So a person across would not feel like there's something wrong, but I knew internally. And so it went on. So I tried on my own, obviously, like I know what to do, so I'm trying on my own and things like that. Sometimes it would get okay, but then over a period of time it became difficult, and I was losing the zest for life, right? So that's when I knew, but at that point of time, the first time when it happened, I didn't want to do anything about it. So the thing is, the series of events that I was talking about, they were not some big things. They were small things, but it was building up. And when your closest circle, your immediate support system, your family, your primary, um, like people whom you're closest to, whether it's family, a close friend, when from there, sometimes understanding doesn't come us knowingly, unknowingly, so many things happen that like puts you off. Plus, we must not forget that with age changes, especially in women, I have seen this, and it's a well-known fact, like not that I've discovered it or something, like with age, with menopause approaching, you often have changes in hormones and changes in neurochemicals. So that's when again what you could bear earlier and cope with easily makes it very difficult. So then my very close friend said, like, I mean, I won't have you doing all this. Like, I won't have you just sitting around waiting for more and more energy to be drained and you going down in the dumps. So I'm going to take you. So she took me to a psychiatrist who was actually my close friend. It was so bad. Like, I have close friends in psychiatry, but I just didn't have the wish to get well. that was bad. So then she took me, and then I started with medication, and yeah, and then like things got okay. I mean, that's not the whole thing, obviously, but I don't want to grab that whole episode and push it down your throat just now.
No, but thanks for opening up and pouring your heart out. I know it may be difficult also right now remembering, but thank you for
No,
that.
no, honestly, it's not difficult at all. But it's just that if I go into the narrative, you know me, like I can just talk, and then the whole hour gets over. I don't want to do that.
Okay, thank you for that. So, Sulbha, generally, it is difficult to accept that you have mental illness and also medication. You talked in your video that you took medication.
Yeah,
Was there any resistance? Did you resist taking medicine or resist accepting? How did you accept that this could happen to me being a mental health expert?
No, like I told earlier itself, right? I mean, because I am in mental health, I have the reasonable knowledge to know what is it. So first of all, I want to, make this give this clarity that everything is not illness. You go through some conditions, some periods where you face anxiety, depression, whatever, etc., etc. And these are of a low grade. So by your own methods, by support, by time passing, etc., and you accepting whatever it is and getting back on life, you get back okay. Then there is a space where it is making you dysfunctional for a period, right? And these are conditions like episodes of depression or panic or whatever. It will be only for a period. So we can call it like a disorder, maybe like or whatever. So it's a short term thing. And then there are other things which are long term, like those are illnesses, which are probably takes years or maybe sometimes lifetime that you have to manage that condition. That way. So what
One
I
sec,
had was
somebody is on mute. I have to unmute somebody.
yeah. All right.
Yeah, go ahead. Yeah.
Yeah. So what I had was these episodes. So it was not an illness, but it was these episodes. So whether it's illness or episode, the basic thing is that you recognize it because you have the knowledge, and then you also know that it can get okay. It can be managed well. So getting okay, not as in like there's an infection, you take antibiotics, it's totally cleared. Sometimes it can be that way, like it happened with my depression, but also with panic attack. But then there are some things where you take lifelong medication, but you manage it well by doing other things which come through therapy and which comes through self-realization also, that okay, these things work for me well. If I do this, then I'm able to manage my condition better. So you become an equal partner in getting well. So that was the thing actually, that I don't think that, for me at least, there was no issue about accepting, because that was a fact. I mean, if I don't accept, that's what I was that was what was happening. No, I had accepted that there was depression, but the very fact of depression makes you not want to get well sometimes. So that's what was happening. But when my friend did take those steps, I cooperated because I know that she cares, and I know that I also care for myself. So that was it.
Okay. So taking medicine also was as easy, accepting.
Definitely. I mean, I know how, like, I have seen my patients get well with medication. Why wouldn't I give myself that kind of benefit? I mean, medicines is not something to be feared, especially people get scared about psychiatric medicines because you know how it is, like the same as with brain and mind, people get scared because there aren't like these blood tests, like, you go do a blood test, you get high sugar, and then you have diabetes. It's not like that. It's very, for them, it feels very ambiguous. But for the professionals, it's not ambiguous. So that's the thing. So medicines do help. Along with that, there are certain lifestyle changes. Along with that, there is therapy. So all these things are very well constructed to get you back on track.
Okay. Okay.
What is there to fear?
Thank you. So I want to know, after you took that therapy and on, how long did you took, and what are the visible signs that this is working? For the audience, it will help,
Right. So generally, if depending on the condition, if medication is required, then it's advised generally, even by the psychiatrist or a psychologist, that you take the medication for a certain period of time, usually anything from 2 weeks to 4 weeks. You get to a stage where your mind, your brain is ready to accept and it will be able to perform the way in which therapy is done. Like in therapy, you discuss things, so your mind has to be available to me, right? And then what happens is during therapy, you set out certain goals, like, and you do things in between two therapy sessions, which will take you to the next stage. So while you understand it, if your brain is not at the appropriate level of performance because of these neurochemicals which are clouding the brain, medicines sort of neutralize them and get your thinking circuits open to being able to actually apply all those techniques in day-to-day life. And that gives you confidence, right? So usually a period of time goes before you start therapy, and during therapy, depending on how consistent you are and how well you do the things in between two therapy sessions, your recovery is faster. But of course, I can't set a time limit to it because it depends on the conditions, it depends on the genetics, the heredity of that person, the family structure, what kind of support system is there, in general, what is the health like, all these things, a lot of things, and how much is the person willing to do these things consistently. It depends on that. So I wouldn't really put a time link to it. But for me, initially, like a period of, I think, about 3 weeks of medication, I was like more than 70-80% on track. And then I started with therapy. Luckily, because I'm in the field, I didn't take very long. So after that, I could, like, rely on my own resources, and I kept touching base with my therapist. And luckily, like, apart from the regular therapy sessions, because of the kind of friends that I have in the field and outside the field, it was really great. You feel very warm, you feel supported. I could reach out to them anytime, and I took advantage of it.
Thank you. Thank you. In fact, you're very lucky to have these friends in the field and all, because I have spoken to a couple of psychiatrists and psychologists that they don't tell because they will lose respect among peers. That is one of the fears,
Ah,
mental health expert, even if they are taking medicine, the
right.
fear of losing respect among peers. You never had that
Hmm.
kind of a thing?
So I probably could have had maybe fleeting thoughts about it, but I think my total trust in my friend, who the psychiatrist that I went to initially, that I think saved the grace, saved my day. And I think, like, amongst most of the time, amongst even all the psychiatrists and mental health professionals, there are surely people who appreciate this. And for that matter, if I were to keep thinking about what will this one think and what will that one think and so on and so forth, I am like keeping myself lowermost on the list of priorities, right? I have to trust myself, I have to respect myself, and I have to value myself. And then I can come to the point whether, like, I will not think beforehand, I will see afterwards. So, yeah, basically, the thoughts did cross my mind, but I decided to take that risk. And I think it's worked very well for me.
Thank you. You
And
said something
if at all,
powerful. Yeah, sorry, go ahead.
if at all some people may have thought, like, like, oh my god, she has this, that, and the other, and how can I have not come across them. They may have thought in their own mind and whatever, but most of the people that I have either that time or later shared it with have been extremely understanding and supporting, even within the mental health profession. So yeah, that was that.
Thank you. In fact, it's very powerful when you say that what people may say, but I have to think about myself. I need to get
True.
well. Yeah. Then
Absolutely.
people are secondary. So a lot of people stop because of that thought. Okay, what will people think?
Right, right. And to tell you honestly, like, in this whole thing, like, what I feel is, if at all somebody were to, like, in the profession, somebody were to think less of me and they drop me from their list, maybe they're doing me a great favor, because if a mental health professional doesn't really respect somebody who's coming out in the open with
Yeah.
their problems, then I don't know if I really want to be in touch with them anyways,
Right.
right?
Right.
And to tell you, like, see, when the first time when I had the depressive episode, and that time it was really bad, like I said, I didn't want to take help at all till my friend pushed me. um, that time, actually, when before that, like before I came to that stage, I was noticing that I was feeling this low, drained energy, and I did ask my my teacher, my mentor, my hero in the field. So Tatte madam, I asked her, like, this is what I'm feeling. I'm feeling very low, this, that, and the other. What should I do? Should I stop counseling for some time or whatever? So what she said was, trust your gut feeling. She said, there's no need to stop. This is work that you're so good at and you're enjoying it and all. Do it. But if you feel that you're not really performing well and you're not really being able to help the patient, then you take a break. So I went by that.
Okay. Okay, good. So you also ask for help. Here people are
100%.
ashamed of asking for help. You help. You went to a mentor, so that is a good learning for us. There is no shame in asking for help. So Sulbha, between your first and second, when you had the second episode of depression, were there any triggers, or could you relate to the first one? Okay, oh, it happened that time, so I'm aware of it, and now I should take help immediately.
Yes, that definitely happened, because this time my friend, I didn't need to, get my friend to pull me away, like the moment I noticed this in the first couple of days itself, I myself asked my psychiatrist friend to take a look, assess and see whether I needed medication. And yeah, he did give me those.
Okay.
So that happened. So that I took action pretty much early, because that did help me. And when you ask me about triggers, yes, they were like, of course, stressors building up, because whatever had caused those problems early on, that was actually because of gross loss of trust and losing sense of belonging for various reasons in the immediate group that I had always connected with and relied on for being mine, like accepting me and understanding me and all, and being there. And so I know that this sounds very vague, but no, it's really very deep. Okay, and this happened, and that of course continued. And that I wouldn't blame them for it. What happens is, like, I have this image and this aura of being strong and being efficient and always being able to manage, and years on end, like even before I've been in mental health, people have always reached out and depended on me for practical reasons and for emotional reasons. So people tend to feel that nothing can ever go wrong with me, so when I'm talking about these close people, it's not as if they didn't want to help, but they just couldn't wrap their head around it that something can go wrong with her. So they just kept on being in denial. And I looked at it as, oh, they don't want to really pay attention to me and they don't want to understand me. But it was not that. It's very difficult for people to accept that a person who's supposed to be like a rock of Gibraltar can,
it could happen to her.
Yeah. And especially because I was in mental health already. This, like, what can go wrong with her? I mean, it's not allowed. And like I said, I was looking okay.
Right.
I was like doing all my household duties
No
and my
visible
work
signs,
and like whatever, no visible sign. But yeah, so that's what happened. So then that was already building up. And then there were 3 deaths in the family, very close family, suddenly, one after the other. Within 2 days, there were 3 people dead, and all of them close to me. One of them was pretty much young, about my age at that point of time. So yeah, so then I guess that generally just like make me go down slide in a rush. But then I noticed, and then within the 3-4 days itself, I went and checked with my doctor.
Thank you. It must have been difficult sharing all this, but thank you so much for opening up. Thank you, Sulbha.
Thank you.
Yeah. I want to ask, my next question is that, coming to the 2 sets of depression, do you think there is a fear that it could happen again? It's happened twice. Is there a thought back of your mind?
Yeah, so after that I've had some periods of sadness which are not depression, and that happens to everybody. I mean, that's a normal thing to feel, and that's okay. I don't fear that I'll get into depression. In fact, I am very much aware and I'm confident that if at all it does happen, I know very well how to get out of it. I know who to go to. I know what to do myself, and it doesn't make me feel afraid or anxious about it.
It's like when I get cold, I know what to do. It's as simple.
Exactly.
Thank you.
It's like my daughter, when she was very small, I mean, she's also hyperactive, whatever. So she had 3 fractures. Okay, so like, okay, I mean, after the first fracture, okay, fine, like whatever, like a whole lot of things were done. Oh my God, this, oh my God, that. And then the next one, okay, fine, we know what to do. So it was okay, it's like that.
Right, right. Good, good. I mean, after the first blow, everything is fine. You've been through that. Yes.
Yeah, so it's not easy, but it's doable. Yeah.
So, since you also talk about your panic attack, and I've seen your fantastic video where you talk about it. So, is there some correlation between depression and panic attack? And can you share the journey, whatever you're comfortable about the panic attack?
No, see, so the panic attack I feel was a combination of some stressors building up, but mainly about the sudden changes in hormones, because I went through hysterectomy around that time. And then there was like this one big episode related to a very close friend who, without any warning, had suddenly just stopped talking or whatever. And when I've tried to reach out, like there was nothing. And for me, like, I don't know, like I think that is my strength, as well as sometimes that is the cause of trouble. But connecting for me is like oxygen, like it's something very deep for me. Like if I feel like a friend or a relative or whatever is very close, then they are very close. There's no two ways about it. So for me, it's like not just by the way, like, oh, okay, fine, if it doesn't talk to me, like I don't care, like it doesn't happen like that. I will accept it, but they will be hurt and I will have to work on healing that. So that is what happened, and that was one of the first episodes ever that happened in my, like, years and years of friendships that I had maintained. So it was very unnerving. It's another story that much later it turned out that, okay, she had herself been going through some mental health problems at that time, and that's what had caused it. So later on, of course, like we reconnected and things were okay. And in fact, I helped her, take mental health help later on, and she trusted me enough to do that, which was a big deal. So yeah, all these 3 things came together, and that's why I had those like panic attacks. It was mainly physiological, I feel, and that's the reason why it got okay also very fast. I didn't really have to much do anything about it.
Did you take medicine for that?
Yeah, of course, of course. So the first time when it happened, I let it pass. I used the breathing and all that stuff. But then the next time when it happened, after maybe a span of 10 to 15 days, that's when I consulted a psychiatrist. So because I didn't want to just sit on it, like I don't want to. The best thing is, like in any kind of psychiatric issues, any kind of psychiatric psychological issues, if you take intervention early, whether it's medication, whether it's therapy, or whether it's self-care, if you take intervention early, then definitely you get out of it much faster and much stronger.
This is very powerful. We always procrastinate. I'll manage my mind. It will go away. I'll do this, that. But this is powerful to
Yeah,
take intervention early.
absolutely. And I'll tell you this we don't do this just about the mind. Even about physical conditions, we sit on it.
Yeah.
Like, I mean, there is this time where there is this, I have some pain in my shoulder and, radiating here. I tried doing whatever, like, fomentation, this, that, exercises, right? But when it didn't work for a while, I did go to the doctor. Whereas I know, um, okay, without really mentioning who, I know somebody very, very close to me who has very severe back pain, spinal involvement, but didn't do anything about it for nearly 8 months. And then it came to a condition where he couldn't move out of bed. And then there was like very serious interventions that had to be done, like surgery and all.
Okay, a stitch in
So
time saves 9. Yeah.
absolutely.
Okay, so I want to ask this question that since now you are aware of this depression, panic attack, what are the steps you take since there is so much awareness that this should not happen, or what are the things you do to prevent this recurring?
Okay. So I have worked a lot during the interim period, and I continue to do that. Worked a lot on how I interpret things, how deeply do I feel the need, like I said, it's like oxygen, that is danger. It has to be like a want, right? Connecting should be a want, a pleasurable thing. It should not be like oxygen. So I've done that. So I still connect deeply, but it's not like oxygen. All right. That was very important, because then I become very demanding. I must have this. They must be there for me when I want it, the way I want it, etc., etc., etc. So that is important. That is what I have done. And even though I hurt sometimes, I talk about it, well, first of all to myself, and then to some close person who can understand and listen to it non-judgmentally. That is what I do. The other thing I have done is definitely take out time for myself every day, every single day. So I generally get up in the morning, do either I go for my yoga or I go for walk, and I have some meditative practices which I do, and I spend time every now and then. I spend time with friends and with close relatives with whom I vibe very well. I learn new things which may or may not really be of any technical use for me later on, as in, like, I've learned horse riding sometime, some couple of years ago, and like I've learned qigong, and I've gone to one songwriting workshop where I know I'm never going to write a song, even though I write poetry. So that kind of a thing, like just for the heck of it, just for pleasure, just for learning, just for experiencing. I travel whenever possible. I go for movies and, things, anything, music. Oh my God, yeah, all these things, dance, whatever that can take me outside of myself, and wherever I can get in positivity from within and outside my environment, from people, from nature, from experiences, I do that. And that is a must.
Sulbha, this is so inspiring. Now, instead of waiting, why me, you're doing something about it. Now, how to make sure that you stay away from such thought. And this is very
Yeah,
powerful. You said, instead of oxygen, I need them. Otherwise we are becoming so dependent. Okay, he did not call
absolutely.
me. You did not include me. But it's okay.
Yeah.
That's a lovely shift.
Dependent, not just dependent, you become obnoxious, you become demanding. Like,
Okay.
oh, he or she must come when I want,
Yeah.
the way I want, and spend time with me exactly the way I want, etc.,
Right,
etc.
right, right.
Yeah, it becomes a little too much.
But I'm glad you are talking about it. And this is so empowering, because we sitting in the audience want to say that, oh, you did not call me at the party. You only gave me a WhatsApp. You did not call me, They're
Yeah,
not fitting into our expectations.
true. And you know what? While I'm saying this, I want to make it clear to everybody that that does not mean that you ought not to feel bad. And anything ought not to, must not, must, that has to go out of our dictionary. It's very natural, right? If I say, like, a friend or somebody I feel I'm close to and doesn't do the things the way I want, I'm bound to feel disappointed. I'm bound to feel sad. But it should remain only at that level. It should not go to the extent of, oh my God, the whole universe is against me, that way.
Or you cut
So,
off that person, right?
yeah,
Boycott them.
yeah, exactly. So, feeling bad is okay. Feel bad, sit with it, figure out exactly what's happening, and when possible, convey it, have a conversation with that person in a way that that person can understand. You've got to talk that person's language. So it's not about blaming, it's not about pointing out, it's about sharing your journey, about how you dealt with that situation, so that that person also understands, and that person also gets it, that you're not blaming, you're not like pointing out, you're not cornering, but it's just a better way of connecting.
Yeah, this is so powerful. Sometimes, Shulva, we blame the person, because of you, I'm suffering.
Yeah,
And then that person will get defensive, right? So this is very good that
absolutely.
to have a conversation instead of
Yeah,
blaming.
and the same time sharing also, like, the way you share positive feeling, you can share negative feelings, but first you've got to be on level, you've got to be grounded yourself. If you talk when you're still in the throes of that emotion, then you always convey the wrong things.
Okay, okay. So
Yeah,
Sulbha, people want to ask questions, so I want to keep this short so they get chance.
sure.
I just two questions I have is that there are people, mental health expert in your fraternity who also want to talk, but they
Mm-hmm.
are scared of losing patience, respect, or what is a message you could tell them who really want to come out and talk?
All right. So, like, you have seen the panic attack related video. Similarly, the video is like there out there for whoever. Some people have actually seen that video and come to me saying, like, okay, this therapist can really understand because I've gone through the same thing, right? That is one thing. So instead of losing respect, in fact, people find you more approachable. It depends on how you present it. If you present it like one soft story, and if you present it like, oh my God, such a calamity and da da da, whatever, then probably they'll get shaky. But if you share your journey of how it happened, it made you feel whatever, and how you took charge of yourself with or without help, as in with or without help of the support system, and how you went ahead to take professional help, that really works. So it's not that like they lose respect for you. In fact, they feel you are more approachable, and they feel that you are definitely going to give them a good hearing. You won't be judgmental, and you can understand. Also, at the same time, it's not necessary for you to exactly go through the same thing. So even if, like, say, I've had a panic attack, but someone else is suffering from, say, OCD, people understand that, you know, you have experienced something which has been deeply disturbing, may have become debilitating for some time. So you will be able to understand that person's problems, that person's limitations, and that person's emotional upheavals better. So this is what it is. Sometimes it has happened that, sharing about these things comes at an appropriate time, if at all it is required. It has not to be done every now and then, right? So if it is going to help the therapy process in with the client, then you do appropriate sharing. So this is what I would tell mental health professionals. So use your judgment, how much, when, what, and in what flavor you're sharing, and whether it is appropriate to that moment and appropriate for that client. The client should not get overwhelmed thinking that, oh my God, like if a person in mental health can have this problem, then the world is not a safe place or whatever, or that I can never get over because they have the education and they can.
How will she be able to help me, kind of a thing?
No. If having had this background, she still underwent this, then I am, so I don't even know anything about mental health. I have no background. I'll never be able to recover. So that flavor should not come. So it should not come from a mastery point of view, like that, oh, I'm so great, like, I've overcome this and all. It should not be that way. It should be like, explain the
Relative.
process in short and give that the end result, the outcome. The aim has to be giving that person hope and agency that you can do this. I'm there to support, you can do this.
Right. That's very nice. As you said that if somebody has seen your panic attack and got inspired, let's look at the positive side, not what other will think. Na? Somebody is
Yeah,
coming to take help, except somebody will also accept the panic attack na, when you talk about it.
exactly. And I'll tell you something, like we have this, for some reason we have this paranoia that, oh God, everybody is going to think about me as something inferior. But it's not like that. People are very sensible. People are good. People understand. There may be a small population who may feel like, oh my God, how can this happen? And then I don't want to go with this person. A small population. But most of the people are very sensible. They're good. They're understanding. And they have that perspective of a doctor or a mental health professional being human first.
Okay, thank you. So my last question is in two parts. You also talk about your ADHD and there are certain patterns and you've come to that conclusion and that you are taking as a positive thing. It is help you in your profession. So can you tell me about how did you find your ADHD and what was your, first, your first impression or first response when you said, okay, मुझे डिप्रेशन है, मुझे था पैनिक अटैक था और अभी ADHD है. So what was your response and how did you accept it and what makes it help? You are taking it as a positive side,
Yeah.
profession.
In fact, to tell you the truth, all the three things I take it as positive, though at that time it was burdensome, but in hindsight, it has been positive because I have been able to understand, one, what are my strengths, inner strengths, which I had not yet discovered. I have also understood what in my support system, whether personal or professional, is there for me to take advantage of, to reach out to whenever I need something. And it has helped me weed out the people who I can depend on and the people who are just there at fun times. So it's like actually very good. And the other perspective I feel I must share is all these things, no? All these mental health problems that are there. It's just like the body, as in, of course, mental health problems comes from the brain and the mind, but basically about the body. See, if you have aches and pains, what does it mean? That you're overworking that system. If you have some problems with your liver, it's basically when you don't take care of your body, the body starts shouting, the body starts telling you something is wrong, please pay attention, lie down, take rest, take medicine, whatever it is. It's the same thing with the mind. So depression is where your energy is low. And I know that for so many years I had been coping with so many things and overworking my brain in things. So the depression was my brain telling me, step back, take it easy, don't try to, manage everything all the time. Like, just take a step back and rest. So this, like, the brain was forcing me through my body to tell me, you've got to stop, take a couple of breaths, stop and slow down. So it was really very helpful because I have changed my lifestyle after that. Same way with panic attacks. Like, the panic attack was a wake up call for me to pay attention to my body, the changes that are happening in my hormones, the changes that are happening in my neurochemistry because of my age. And of course, like this thing about like how the close relationships I had been considering at oxygen. So I had to redo that math and make it like a need, a wish, a reaching out rather than making it compulsive. So both these things have helped. And the same thing I would say about ADHD. So you are talking about ADHD, yes. What I had right from childhood was the atypical, which is very common in women, where you are more internalized. So you're own in your own world and you're withdrawn, and not withdrawn in the sense of being sad, but withdrawn in the sense of being daydreaming. And so many things. And there's creativity and there's like this procrastination, so on and so forth. So many things. So and at that point of time, like way back, there was no concept of mental health. I mean, either you're mad or you're okay, nothing more than that. Right. So, yeah, but later on, when I got into mental health and I started seeing things, and the more I interacted with patients, I'm like, hello, I have so many of these things, and it's like my transition from the time till after teenage, I became an extrovert to some extent. So, like, sometimes I would be still withdrawn. I wanted my own space and time. I would be low on energy. I would still work last minute, etc., etc. But I started becoming aware of more and more of my energy. And then I realized that earlier my energy was all being channelized through dance because I was heavily into dance. And there it was getting channelized. So there was no question of it extra remaining to be all over the place. Plus, my brain was working overtime. I had fantastic ideas. And I would be so engrossed in them all the time. Like, so that is how it was. And then when I started realizing, and where my physical energy was also becoming high, it was so much of an advantage. I would never be tired. I could during college or even later, even now, I can like get up early morning, do my walking, yoga, this, that, and the other, do the whole housework, and then have sessions right from like 9 o'clock in the morning till late night, and still be ready to go out with friends and like go for a late night movie and whatever. And at the drop of a hat, be ready to travel just by no qualms like about like I have to have this like so many clothes and this reserved this like just on the go like anytime. So all these things plus my curiosity, I think that has helped me immensely in my work apart from everything else. Because when a person sits across, I am not looking at them as a patient. So they're people, they're interesting people, and they've come to me where they have tried so many things to get over so many difficulties, and some they have succeeded. So these success stories also come to me, not just the problems, and I learned so much from it. Plus it's a great thing because then together we work at it like a puzzle. It almost feels like Sherlock Holmes and Watson, that we are both trying to figure out the pieces together and finding where is the mystery and who's the culprit and what can we do about it and things like that. It's fun. So yeah, it's like, yeah, so this kind of a concept. And also I have been therefore be able to be curious, and where I started off years back just with, cognitive therapies, then I have graduated into so many things. In fact, like I just keep learning, and I think I wouldn't have got that and if I didn't have ADD. Like,
Oh,
yeah,
what a positive way to look at it, right? Instead of being a victim, you can be thriving, It's like this.
absolutely, absolutely. And there are flaws. There are flaws. There are so many projects which I started and just left halfway. There are so many opportunities which I have missed. There are so many times where I have been like, I don't want to do it. It's great, but I don't want to do it. Whatever, whatever. So yeah, that happens. Of course, there is also rejection sensitivity, especially with close people, not otherwise. Um, but there's also a lot of confidence, and there's a lot of like I I get these weird ways of working around problems. So nothing becomes an obstacle. Okay, यहाँ पे stuck है तो चलो क्या कर सकते हैं, kind of. So that thing. And at the same time, I can also um, infuse a lot of energy in whatever is happening around the place. Yeah. So I guess it
Thank
helps.
you. Thank you for sharing the pros and even the cons, So thank you for
Yeah.
that. It's very balanced.
Hmm.
Okay. So my last question is that you of course shared, but there are people in your in the group who also want to know that if there is a checklist, like you talked about going for a walk and doing so many
Hmm.
things,
Hmm.
how to take, because they also have had them, mental health challenges, including
Yeah.
me. I'm taking therapy for ADHD. What are the things we should keep in mind to have a healthy mental health?
All right. So I think you got to pay a lot of attention to what's coming from within. Your intuition, your gut feeling, what your heart is telling you, what you're learning from your experiences. Take cognizance of all of those things. So usually, and I believe this in therapy also, not just in personal life, everybody knows what to do. Everybody knows what's the answer to their issues. It's just that, sometimes you're tired, you're stuck, or whatever. So that is where you need to just hold the hand, be there for some time till they feel, okay, fine, now I can take charge. And then through discussions, that insight comes out. And most often than not, the client comes up with, oh, right, like I had done this, I had done that back then, and it had worked. Or maybe I think, considering my circumstances, this thing will work. And then we do fine tune it. So these are the things that I think people ought to do, that trust their instinct, go by their own data. Don't go by like big Bill Gates story or whatever, whatever. We are ordinary people, ordinary lives. And we have a lot of things, lot of data from our own lives. So many things, small and big, that have been difficult and we have overcome it. We've got to go by that. Rather than, like, I mean, inspiring tales are very inspiring, but they are not going to help you in solving your own problems. Maybe you can take the inspiration and then create your own solution.
Right. We get
Yeah.
inspired, but then after that we stop. So instead of doing this,
Yeah.
small, simple things are helpful. As you rightly said,
Yeah.
that we all know what we need to do, but we are not doing it.
Absolutely.
Somewhere we lose the energy or are tired or stuck.
Yeah. Correct. Correct. And see, what happens is sometimes, like when we go for inspirational stories, it feels great when you're reading it or seeing a movie. After that, you feel, यार, but मेरे को नहीं होगा, मेरे से नहीं होगा, like ये तो है, उनका तो क्या ऐसा वैसा, whatever, and we feel like even more disheartened. So, yeah. How you view it, it has to be just like a catalyst to inspect your own thing, your own resources from within, your own experiences, your own surroundings, and construct your own story.
Thank you. And as you also said, to be kind to ourselves. You had told in earlier.
Oh,
Yeah?
yes. Being kind, compassionate, self-care has to be top of agenda at any given point of time. And
Right.
self-care means not just taking care of body and mind, taking care of yourself spiritually, socially, financially, sexually, in a practical way, apart from body and mind.
Okay. I want to ask two questions because I am also struggling with that. Means, what is the difference between having mental illness and mad? Is this something mad is something very
No, it's a very casual kind of a word, and obviously it has got a very negative connotation. But early on, much before psychiatry actually thrived as a medical science, that is how people used to, you know, like either you are okay or you're mad. That's how it was. So mental illness is a broad range of conditions which are very well charted, studied, and of course, research and more studies always goes on to improve on it. So when people say mad, probably, I don't know, I don't use the word, but maybe people mean things look very obvious to untrained eye that something is wrong. All
something
right.
uncommon or something
Something
uncommon.
uncommon, something very obvious, something that like strikes you even without knowing anything, that, oh, this is weird, this is something odd, and I've not seen it in ordinary people. All right. Note that I'm not saying normal people. It is not normal, abnormal. It is ordinary, average population as against a small population at a given point of time, which may have a certain condition. So, in general, if we were to talk about mental health issues, I would resist calling it illness, problem, or whatever, like the general thing that is talked about. Mental health issues, small and big, either long term or short term, are present in one out of every four people in our population. R as in the world population. Same thing with us. So at any given point of time, any one of us, today there are how many people here?
Right now there are
16,
16. Yeah.
right? So at least four people, right? But here, because you people are all in mental health awareness, I'm sure all of us have faced something or the
Yeah.
other sometime, right?
You're right.
But if we were to look at an ordinary situation, like, in general public, any one time at any given time, one out of four people is having some mental health issue going on, either small or big, permanent, long term, or short term. So, what I feel is that by now we ought to get out of this mad mindset. There's nothing mad. Even in the worst cases, I mean, I don't know if you all have heard of Dr. Bharat Watwani.
Yeah, yeah,
He's
yeah.
like in Mumbai, like doing great work. I mean, he's picking up, like he and his team, they're picking up
Yeah.
people who are, according to people, gone cases. Like, they're disheveled, they're like covered with mud and like, lying on the road and talking like whatever, muttering to themselves, etc. Technically the textbook version, or rather the film version of mad, right? And they are taken in, they are cared for, they are given medication, etc., etc., and they are rehabilitated with families. So what
Yeah.
the hell are we talking about?
Yes, yes. That's true. That's
Right?
true.
Even the worst kind of conditions, they are handleable. You just need to have uska nazariya hona chahiye. Like, you have to have a 360, the whole picture. You can't zero in, oh, this person is doing this, therefore they have this, and therefore I stamp it like with a label, and then that's the thing. वो नहीं हो सकता है. The thing is, we have to understand that a person is a whole, and by Gestalt principles, any part, like the addition, the sum of all the parts, the whole is always bigger than the sum of all these parts. So person as a whole you cannot discount, even if there is something gone wrong with some one particular aspect of that person. So if you treat a person, that's what I like, and that's how the client and I always work together as a team, because a person has got so many strengths, so many things that they know intrinsically about themselves and their condition, that they are the biggest resource for me. So I mean, that's about it. Like, you cannot isolate, like cannot take things out of context. So the
Yeah.
person and the environment has to be taken as a whole, 360 degrees angle, and therefore like nothing is impossible.
Yeah. What you're trying to see that one person doesn't define the whole thing, the whole person. He's not that.
One condition doesn't
One
define the whole
condition,
person.
not person. One
Yeah,
condition is more than his
absolutely.
illness. Yeah.
Totally, much more. And
Thank
in
you.
fact, some of the things, again, let's not use the word illness, some of the mental health conditions, in fact, give you a superior ability for certain things. So while there is a flip side to it, there is also a positive side to it. So we reduce the effects of the flip side in your day-to-day life on your personality and mindset, and we pump up, increase the positive side.
Yeah, like you
That
said about ADHD, having a lot of
yes,
energy, want to do things. Yes, yes.
yeah, and that way I am childlike a lot of times, and you know that.
Yeah.
And my young friends always like, ये तो बच्ची है, ऐसे बोलते हैं कभी कभी. So they say, like, on the one hand you are like one bachchi, and on the other hand you are like one wise old woman. So yeah, I have two sides of it. Like, I can't help it. That's good.
Yeah,
So
as you rightly said, you can go to a wildlife sanctuary at the spur of the moment, no planning required.
yeah, that's
Yeah.
true.
I mean, last, if you can give me a short, what exactly is spirituality? It's a very vague thing. According to you,
Hmm.
what is spirituality?
Okay, so for me, it is connecting with my soul, and it is resonating with my energy, which is also running in parallel. It's in sync with my, like, when it is not in sync with my environment, I am not okay. So it has to be the vibe around me and of the universe, which is a very big term I'm using, but that's how it is. So when it is that, and when you understand that, again, the same way, you are just you are just a container, and you are far less, you as a person born in this place is far less of you than what you actually are, considering the aura and the energy that you have around you. So your mind is actually not the brain, but it is what the brain is manifesting through your aura and your energy beyond. So for me, it is connecting with all that, that is spirituality, and it is about acceptance that everything is connected, and therefore each of us, each of the things in nature is a small part of the big whole, and we cannot take anything out of isolation. So acceptance, connectedness, belongingness, and taking this thing as you are far more than you perceive in your body, and therefore feeling the connection and feeling safety in that. For me, that is spirituality, understanding that there's so much more that we don't understand about all these things.
And this also keeps us grounded, now what you say, that
Yeah,
grounded, and there's interdependence, right? Otherwise, we feel
absolutely.
disappear.
Absolutely. Yeah.
Thank you for sharing. And it's bringing out the essence. Okay, so people have questions now.
Okay.
So, Sohendra, please go ahead. Yeah.
Yeah, hi.
Hello.
Yeah, hi, ma'am. Actually, I have a couple of questions. Well, I'll just, like shorten it down. But we are so inspired to see you actually because, I mean, I have been on assignments out of India. And the thing is that I do have friends who work for magazines which are in
Uh-huh.
healthcare on mental health. And the thing is that it's a very common fact in US or especially in Western countries that the thing is that psychologists, therapists do have therapists because their work is so demanding. It's not easy to just listen to trauma of other people like for 6 to 7 hours every day. It's very strenuous job. I tried
Yeah.
volunteering once or twice in an app, but it was so, I used to get transference from them, like
I know.
I
I know. It
used to get
happens.
affected because I was just a volunteer. So anyway, thanks a lot. The thing is that I just want you, and it's so great. Like people have so much of taboo about sexuality, but you said about self care. I think that is the first time I'm hearing about a psychologist like in this forum. Like you said, the self care we should take care of us mentally, physically, sexually also, because I think sexual health is
Financially and
totally,
socially also.
yeah, financially and socially also, because the thing is that sometimes like we just ignore that two part, financially and sexually also, because people just, so you said to step back actually sometime. I just wanted to ask you, like, since you have also gone through, sorry, am
No,
I
go
Yeah.
ahead. Go ahead.
audible?
I
Yeah.
had
Yeah.
posted
Yeah. Go
some.
ahead. Go ahead.
Oh,
Hmm.
sorry. So the thing is that, you just said, just want to ask you, like, since you have also gone through certain traumatic experiences, like, how do someone deal with childhood trauma and, like, if they had abusive parents, actually,
Hmm.
like,
Hmm.
you had friends who were psychologists, of course, you could come out, but If
Yeah.
someone like us, like even Umang is very bold. Like, I mean, he didn't have abusive parents, but he tells openly that his parents actually suffered. Like, how does one, get that support system? Because apart from psychologists, we don't open up to other people. Like, is it healthy, or how do we go about it if we have childhood trauma
Um,
or abusive parents?
So, first of all, I want to clear this thing that, like, I did say that I have friends who are psychologists, but all my friends are not. In fact, some of my closest friends are not in the psychology field at all. The ones that I talk to, and the ones who are really very much more understanding, they are not all psychologists. They are like just from other professions, or even like some of them are way younger to me. So,
Okay.
it's not about that. That's one thing. Uh, Secondly, no, I'm sorry. Because of my distractedness, I have forgotten what you asked. You have to
I
repeat.
just asked that, if like someone has gone through childhood trauma and had
Yeah,
abusive
yeah, okay.
parents,
About abusive
like,
parents.
how to acquire that, because it's still a
Yeah,
very taboo in India. Like victims are being, like victim blaming is there. So yeah.
true, true. So, to tell you honestly, it's the same thing everywhere. All right. It's just that the words that are used are different, because I'm in touch with people from Europe and US, Canada, etc., etc. It's the same thing everywhere. It's just that it's differently worded, and the context is different sometimes. So the thing is, as of now, we are at an age where we consider ourselves as adults, right? So I would ask you, why is it that we are holding on to that trauma when we were children and helpless and dependent, and where as a child our brain universally, not just here, universally our brain is programmed to consider parents as um, good, supportive, and dependable, and that trust gets betrayed because of different things. Now, I don't want to justify this, but why would parents do that? They probably had their own problems, whatever. They are victims of their own past. So instead of taking it as, oh my God, I suffered and my parents this, continuing along that theme is going to pull you down into that mire again, right?
Yeah.
So instead of that, what we can say is that yes, these bad things happened to me. It should not have happened. I had expected to have a supportive, caring, good environment for me. It didn't happen, right?
Yes.
What, like I said earlier, what good have I learned from it? These things happened. So those things when happened, it has made me manage something somehow. That's why you've reached here, right? At this stage,
Yes.
correct?
Ma'am,
You're still existing.
one thing I wanted to tell you, like,
Ah,
especially with the LGBT community, like, we go through a lot of, like, I mean, no, I'm not the only one. Like, I think a
yeah,
lot,
yeah,
one out of 5% will have abusive parents who will just
absolutely,
abuse them.
absolutely.
Yeah.
Yeah, even outside of LGBTQ community, it happens,
Yeah.
right? So, and then those children come with several different conditions. Like there will be ADD, there'll be many different things, OCD, there'll be like personality disorders. All these things come when there are dysfunctional parenting or dysfunctional family atmosphere. All
True.
right. And not just because of that. That is one of the predictors. It's not because of that. The thing is, I'll tell you what. We inherit our chromosome, we inherit our genes from our parents and their family tree, right?
True.
But which gene gets expressed depends on the experiences, the environments, various different factors. So this is a new science that's come up in the last like couple of decades called epigenetics. All right. So why it gets expressed is very personal. So how it affects you may not affect some other kid. All right. So considering that, what I feel is now that you're here, I'm just like randomly assuming now that you're an adult and you are say maybe 25, 35, 35 years old or whatever, you
Around
can ask
30, yeah.
yourself, you can ask yourself, what is it that I has brought me here? So a lot of we focus on the negatives, right? Negative experiences, negative feelings, etc. Now let's ask ourselves what has brought me here. Obviously, you survived. Some things which you picked up over there and you managed served you the purpose over there, but now they are dysfunctional. So, for example, when you were 10, you probably were using a certain favorite set of shirt and pant, whatever, right? Are you still using it?
No.
A certain pair of shirt and pant, I said, or a blanket, because it gave you comfort, it made you feel good. Are you still using it? No, right? The same way, that particular habit or that particular way of surviving, very often it happens that you will shrink back, you will withdraw, or you will be isolating yourself, or you will have a temper tantrum, or you'll start self-blame or blaming others. These are the typical kind of outcomes of parental abuse. A lot of self-confidence issues. Yeah,
Yes. Lower
right. So
self
all these things,
confidence.
correct. What is the meaning of low self-confidence? You will not step out and do something without having that permission.
Yes.
Correct. So
Well,
you want to withdraw. Why you want to withdraw? Why you want to not put yourself out there? Because if I do something, I am afraid that I will get a scolding, that I will be disapproved of, whatever. So that behavior has helped you there, right? To save yourself from extra scoldings, extra
Exactly.
criticism. So that behavior helped you at that time. But now that you are 35, you still need to follow that pattern, which is now dysfunctional. At that time, it helped, but now it is dysfunctional. So you have to stand in front of the mirror and ask yourself, who am I now? Am I that helpless 5, 10-year-old child, or am I a 35-year-old person?
I'll be 32. Like,
Whatever,
yeah.
30, 32,
Yeah.
22, doesn't matter. Am I an adult now? All right. So inside you, there is a child and an adult and a parent. Now, when you say, like, whatever, you might be facing some moments of self-doubt or like low confidence, and all that time you have to ask yourself, what is the voice in my head telling me? It is the voice of the critical parent. You are this, you are that, you won't be able to do this, don't try this, you're going to fail, whatever. So take a couple of breaths, and the child inside you is terrified, so he wants to withdraw, right? So then take a couple of breaths. Tell the child to rest behind you. You're the adult. Rest behind you. Tell the parent you sit quietly in the armchair. I don't need you now. I'm an adult. And in the adult position, ask yourself, now in the position that I am, what is the task before me? And what do I need to do so that I enhance my chances of doing it well? Whose help can I take from the outside, and whose help, like what resources within I can use? And that way, you can slowly learn to shush down the voice of the critical parent by telling it to just shut up. You don't need it now. Sit in the armchair, look outside, enjoy your coffee, right? And the child inside you, you hold him safely behind you. I am there. I am in charge now. I am the adult. I'll take care of you. I'll love you, and you are going to be fine. And then you see what difference it makes.
Sure, Dev.
thank
Thank
you.
you
That
so
was
much.
amazing. You actually gave us a tool, a demo. The
Thank you.
child, adult, and the third one is what?
Parent, the critical parent, don't forget, that's the worst thing when there is being parental abuse. I mean, it's sad to call it abuse because most likely parents don't mean to abuse. It's just that they don't have the wherewithal to manage their own issues from their childhood. That's why they'll end up doing these things. So yeah, but we are better, right? We have resources now that we can use, so we don't have to carry it forward.
Yeah. As you said, you're no more than 10-year-old. You are now 32. You can take that decision, not
Yeah,
dependent, not take
absolutely.
approval from them. Yes. Thank you.
Correct.
Thank you so much, ma'am and Uma.
Welcome.
Sulbha, you want to take some water or something? You want to take?
Yeah, that will be good. Yeah, but anyway, I can listen to
Sure.
any
Okay.
questions if at all.
Next question. Please go ahead. If you have a question, please unmute and ask, or you can ask me in the chat box also. If you have a question, please unmute and go ahead.
Here, I would like you all to also use some imagery. Like imagine in your mind, there are these three fellows in you, put faces to it. You as the little child, you as the adult, and the parent's face usually will be the critical parent, who you have experienced. Or maybe you can imagine some other face of, I don't know, a villain or something. And then, or an authoritative, aggressive authoritative figure, whoever it might be from the cinema or the history or whatever. And if you imagine these faces, it's easier to do this kind of an experiment, this kind of an experience where it empowers you.
Thank you. Yeah. Does anybody have a question? Please unmute and go ahead. Hemant, yeah, go ahead. Hemant? Okay. Till Hemant get ready, anybody else want to unmute and ask a question? Please go ahead. Yeah, go ahead, ask your question. You don't have to sit quiet. You have to ask a question. Otherwise, yeah, Apurva, go ahead. Apurva, looking good in your new haircut.
Thank you. Sorry, I joined a little late, ma'am. I was a little late. But
No
I just
problem.
want to share my experience that thank you, ma'am, for explaining about energy, aura, because I can really see that working in my life right now.
Fantastic.
I have also come from a background of childhood trauma and I took help at the age of 43. But now I can see how beautifully everything is being transformed because now
Super.
I'm able to seek insight in my, I'm able to connect with my inner soul and I'm able to connect with the cosmos. So it's a beautiful thing, ma'am. So I'm very happy that you shared with us here, ma'am. Thank you, ma'am.
I'm happy for you. It's a very good thing you've done.
Yes, ma'am.
Thank you, Apurva. Yeah, does anybody have a question? Anybody? Yeah, Rave, go ahead. You don't have a question. Okay. I thought you raised your hand. Anybody who wants to ask a question, are struggling with something, have a question which is bothering you, please unmute and go ahead. Or you can send me in the chat also. I'll take it from there if you don't want to speak out. Okay.
I have another question. Can I ask Uma to ma'am?
Yeah, one sec. Let me take a question which has come in the chat and then I'll give it to you.
Yeah, sure.
So there is a question which says how to let go of the past, you know. It keeps recurring that why didn't I do that? Why didn't do that? Why didn't I speak up? So there is a question how to let go of the past, which keeps coming now in the present, you know, the regret.
Okay, is it okay for me to ask who has asked this question? I can use the name, that's all. I don't need to see the person. Because it's very...
It was an anonymous one.
All right, no problem. So what I would like to ask all of you is, suppose I were to give an answer to the why. Okay, any question, any question of why did this happen? Why didn't I say this? Why did I do this way? Why not that way, etc., etc.? Or why did they behave in such a way and it's so unfair, whatever. Suppose I have this magical insight and I can actually get into people's mind and extract the question, the answer to that question, why. So whoever is a perpetrator, I enter their mind and I tell you the reason why. Oh, they did this because they felt you were not worthy. Or they did this because they felt it was the right thing to do. That answers your question. Is that sufficient? I'm sure it's not. Because that answer will generate another series of why. Right? So beware. These are the villains in our life. Why? What if only, etc., etc. Right? These are all things which are like, you know, why this, if only this, dot, dot, dot. And we never fill in the blanks because it's a never ending thing. Instead of that, ask yourself, all these questions that are coming from wherever it is, where do they belong? Almost always they belong to the past, right? Now, if anybody has a time machine and you can travel into the past and undo it, please help me. I mean, I have a lot of things also, right? No, but that doesn't happen. So we have to actually tell ourselves that we have to be rooted into the present, take the learnings from the past. Like I told about my own story, I know now who to depend on, who not to depend on, which are the internal resources, which thoughts really pull me down, which attachment, the level of attachment that bothers me, etc., etc. So I know I am really definitely better informed than when I was 20 or 40, right? So this is what the advantage of the past is, because you can analyze and you can learn from it. But if you carry it forward into your present and the future saying, oh, it should not have happened, why did this happen, why did that happen, then you are actually sucking yourself, your energy downwards and dissipating it. And that's why you feel listless, that's why you feel disinterested. Whereas if you are rooted in the present, what will happen? That was past, like I told just now. The childhood abuse belongs to the past. The effect of it at that point of time, it made me do certain things to manage that time. But those very things are detrimental to me just now. So I will leave it in the past and I will see what helps me today, right now. All right. The second thing is, while being in the present, are my circumstances same? No. What can I do now so that going ahead into the future, I will not be faced with such things as in feel like coming to a position where I feel helpless. I may have the same circumstances, I may have the same people in my life, but I will now approach them from a different angle, make changes in the way I approach things, my approach to certain difficult situations, difficult people, difficult emotions. And therefore, I will handle it differently. And that is the thing which is like a googly. You know, it will bowl the difficult situation when it is not expecting. Because you're doing something differently, therefore, you're taking charge of the event to be turning into a different way compared to before. Because if you go according to the earlier pattern, it's going to turn out the same or worse. If it has to be better, you've got to do things different. So be rooted in the present, say that, okay, whatever happened in the past, I can't change that, but I can change my present and therefore influence my future.
Thank you so much. Instead of, kind of being a victim, why happened, you take inspiration or whatever knowledge from the past, it will not happen again. Because as you rightly said, we don't have a time machine and change the past, and that thought is going to be harmful, not helpful,
Absolutely. And mind you, occasionally memories will come and you will feel sad. But if you don't take hold of it and stuff it back into your heart and you just let it go, accept that you're feeling bad for that moment. And I wish it had not happened. I don't know why it happened, etc., etc. And I can't help, even if I know I won't be able to change it. So I feel bad it happened, but I have to let it remain in the past and move ahead.
Okay, thank you. So this is another $1 million question, which mostly the gay community has asked. I am single. I don't have a partner. How can I be emotionally strong?
Oh, you need somebody from outside to be emotionally strong. And you tell me one thing. If you are looking for a partner, are you looking for somebody who is emotionally weak? Or I don't know. I mean, these are terminologies I don't really use, but I'm saying because you all are saying it. Would you, if you were to be looking for a partner, would you be looking for somebody who's emotionally weak? Obviously not, right? So therefore, when you are looking for someone and you're coming from this position that only when there is somebody appropriate in my life, only then I'll become emotionally strong and pleasant and whatever, what are the chances that you'll get someone? Right? First and foremost, you've got to be comfortable and happy with yourself. Then only you attract people, right? Who gets attracted to somebody who is like either sad or complaining or morose or quick to feel angry or bad or whatever? Nobody gets attracted to a person like that, right? The premise behind your feeling low, sad, etc., and feeling lonely, what is it? The premise is, which we don't say out loud, but it's there at the back of our mind. I'm never going to get anybody appropriate. I'm never going to find someone who's really good enough and will last forever. See how many demands we have. I know that it is difficult, not just here, but in most places, it is difficult for somebody to find a partner, whether it's in LGBTQ community or otherwise. Okay. In my personal friend circle, there are people who are still looking for partners, right? So it's not as if finding an appropriate person is difficult, because we think deeply and we have a lot of must-haves. Okay, that's one thing. Also, we are careful about being safe physically and emotionally, right? So it takes a lot of weeding out. So yeah, it's like an unfortunate situation where we will have to keep looking and still being aware of being safe and being emotionally attached and be prepared to be vulnerable and hurt. All these things we'll have to be prepared for if we have to go ahead.
Thank you. That is so powerful, which you started with, that You need to go find somebody outside to feel emotionally strong. That's so powerful.
Unless, yeah, sorry.
That means we are incomplete. Now we are incomplete.
Exactly. So we have to first and foremost be okay with ourselves, feel happy from within, feel fulfilled, complete, and then have a connection with someone else. If we try to fill our void by stuffing someone in, it's going to burst sometime.
And you said, if you're emotionally weak, we are not going to attract somebody, right? We need to.
Absolutely.
Thank you for that, because somewhere this whole thing is I am inferior if I don't have a partner. There is something wrong.
Yeah, absolutely. And it's not a happy situation. Everybody wants somebody close, somebody of your own. Everybody wants, and that's a very natural thing, right? So yeah, I mean, it's not a happy situation, but mulling over it and making that the one important point about you, that's not healthy.
Like you explained earlier, mental disorder is just one aspect of your life.
Yeah,
Similarly,
exactly.
not having a partner is just one aspect of your life.
And it is a current thing. As of now, just underline that.
Yeah.
As of now, you don't have a partner. You probably had some partners before, and into the future, you are likely to have partners. As of now, I don't have a partner in the present moment, and I feel bad about it. And let me see what I can do about it.
Absolutely.
That's how the approach has
Tomorrow, Karthik Aryan will come and propose you. We don't know, na? Yeah, Apurva, go ahead, and then Kalindi.
Ma'am, I want to ask one thing.
Yeah.
On a day-to-day normal life, we do okay. We manage fairly well. But when a difficult situation comes, at the spur of the moment, that is the time when we are really tested. That will we be able to smoothly, gradually overcome it, or we'll go down? So I want to ask you, ma'am, in that spur moment, in that difficult situation, how should one conduct oneself?
All right. So yeah, these situations will come in all our lives, right? So the first thing is that have a reasonable expectation. We should not be in a position where we feel that our life has to be smooth and there should be no difficult moments. That's one thing.
Yes,
just a moment. So yeah, so that is one thing. Secondly, what happens is what happens when there is a difficult situation? There is an overwhelming sensation into us, right? Our chest feels like it's being pressured, then the heart beats faster, your breath becomes slower. Maybe in the body there is restlessness, maybe in the head there is all ants crawling or something. What is your body sensation? First thing, the body will give you a signal something is going wrong. Notice it early enough, and then as far as possible sit back, pay attention, listen to what the body is telling you. The body will tell you okay, this is happening, that is happening, you should have done this, why this is happening, whatever. So then you tell, shush first. Focus on the nose and do a couple of deep breaths. When you do that, a part of your nervous system which releases the calming compound starts getting activated, and it neutralizes the sensations by calming down the anxiety. Okay. Whatever restlessness, disturbance, it calms it down to a reasonable level. Doesn't become zero, reasonable level. And then your brain starts working actually, because what happens is in a high voltage, temporarily the fuse gets shut off. So your brain temporarily gets shut off, and you're only operating from the animal brain, which says, run away, this is danger, or you get frozen or you get agitated, right? Instead of that, you just allow that nervous system to calm down, and then your brain will open up, and then you ask yourself, what is the problem that I'm facing? Put it down on paper, because then it gives you clarity. And then you ask yourself, what are the subtopics? How can I break it down? Which are the handleable things on my own? Which are the things where I can take some resources? What is my immediate need? So when you do all that, you get a sense of partial control, and then you start working on it. All right. Now, all these things will not come suddenly. What you need to do is, since all of us face this thing sometime, maybe having some sort of regularity with breathing practices, or observing yourself, asking yourself, what are my repeated negative thoughts? What are my debilitating thoughts? These are the things that you can do. and work on them when you're okay. When you're okay, your brain actually learns how to do it properly and it stores that memory. So when you're agitated, when you start off with the breathing and the brain calms down, that thing switches on your learned procedures and then you can apply it. So instead of being totally dysfunctional, you become fairly functional. It's not as if, oh, I should feel nothing. It's not like that. Even if I feel, I know how to calm it down to a reasonable level, so I become functional. So if not 100%, I'm 80%, 70% managing in that situation. Okay.
Yes, ma'am. Thank you, ma'am.
Thank you for explaining so much in detail. Na? Thank you so much. Yeah, Kalindi and then Som.
Actually, I didn't have a question, but ma'am has answered so very well that I too would ask earlier guest that what should I do? I'm doing so and so process, but you answered today the same thing, that because when I'm getting triggered, like as short and sweet, yeah, my husband was physically like alcoholic and physical abuser last year,
Yes.
and 2 children and alcohol. So
Correct.
now I have come out of it. It took me a 1 year, ma'am.
I
I don't
know,
know the
yeah.
period is long or short. I always ask Umangji, but everyone scolds me that you don't have to go to the past now, that you have come out.
Yeah,
And
right.
but I have done that now. When I see that my husband is picking up a fight, or so those tools and things I have removed. So I
Very
would
good.
come back. So what I would do is what I do is I come back. I come here. This is my space of HCI, and I have a RM pamphlet, last physical meet.
Okay.
And what I do is when I get triggered, I take half a cup of tea, and I come here. I take a deep breath. I slow down myself, and then first earlier I would watch Kapil Sharma show, but now every time you can't go over there. So I have done
Yeah.
this, and I take half a cup of tea because I was addicted for tea, and that was working me as a fuel. Maybe that is my concept. But everything you told, ma'am, everything I just related with you, that
Very
whatever
nice.
process I've penned down also, and all the feelings whatever you went through, I've gone through. So I totally related with you, and today I can
Okay.
speak up because earlier I was not thinking. And is that the process in depression that you people are trying to tell you, you are new, you have started expressing, everyone is, thank god this platform is not judgmental, because earlier my it was a blame game, dysfunctional family and this
Right.
all. And even the relatives were not coming, totally we were boycotted, like me and my children also. So this all I've come out of it now. So
Very
I'm feeling
nice.
very blessed, ma'am. And
Good. I'm
Umangji, I
happy for
tell him,
you.
thank
Thank
you, ma'am.
you.
And
Thank you,
Umangji,
Kalindi. Thank you so much.
I
Yeah,
tell him that Santa Claus. And so, the thank you, but for allowing me to.
thank you, Kalindi. Thanks. Somendra.
Yeah, hi. Ma'am, sorry. Thanks a lot. I have so many questions and I'm going to ask you, like, being in LGBTQ community again, like as Umang said, the thing is that sometimes, like, even like the thing is that we also get like abusive, like sometimes like partners, if people hook up and like sometimes the thing is
Right.
that,
Yeah.
people get alcoholic, they become abusive, like, because you're just meeting a stranger.
True.
And that point of time, like, how to behave rationally in that crisis moment, actually, because I think, 1 out of 5 LGBT person, like it happens because of the online dating and stuff, like people do get abused by stranger, they come to the house and then, I mean, there was a short
Yeah.
film that also, but it happens. So how to avoid that, or how, can someone behave rationally at that point of crisis?
What are your expectations when you say how can you behave rationally? What do you want to do?
Like, I mean, it has happened like once or twice, like not many times, but like once in Delhi, once in Calcutta with me, like just met someone in some Bollywood event, like and someone came and then after that, like the thing is that he became a little like, because we drank and in that party
Yeah.
something, and he was misbehaving later on. So when I told him
Correct.
to go out, or I told him that shouting and all that stuff, so that point of time, like as you said, the flight fight mechanism that
Yeah.
starts working. Like, how can we, in that crisis moment, you told something I've forgotten, like in that crisis moment, how can we think rationally that we can do something.
So correct. So
Sorry.
what I'm asking you is, when you say I want to be rational, how can I deal with it rationally? What are your expectations? What is the outcome that you're expecting? That I should feel like very calm and I should have no feelings at all. I should not get flustered, and I should be able to see to it that this incident doesn't occur at all. Or I didn't get that part
Yeah, I
of it.
mean, it has happened. How do we minimize that? Like rather than
Right.
fighting or totally flying, like
Okay. I get it. Now I get it.
Sorry,
Okay.
like that's yeah.
No, it's very natural. Like, see, why I'm asking you is because sometimes people will expect that such incidents should not happen at all, which is not in our control totally, right? Because
Yes.
another person is involved. So we can't totally control it. But like what you're saying, how can I minimize it? That can happen. All right. Or if something
Yes.
like this happen, I should feel extremely calm and in control, and I should not flinch an eyebrow also, and like whatever, that kind of a thing won't happen because we're human beings. We will feel. It's just that it should not go beyond the point. Cooker ki seeti nahi bajni chahiye. Like, it has to be below that pressure where you are still able to use your cognitive resources and you are still grounded. You don't lose touch with yourself. All right. So if these kind of incidents have happened with you or others and you're in know of it, then we know the kind of cues that we can pick up. All right. So there has to be some place where you start observing a person beyond, like, see, generally when we are interested in having somebody over, picking up a partner, having a good time, going on a date, etc., then we are so consumed by that desire that we
Yes.
fail to pick up the negative cues, or even if we pick it up, we just ignore it, like baki sab acha hai na, forget about this kind of.
Yes.
Yeah. So that is what we have to not ignore. One part of it, like, see, there are two parts of us. One is the monkey brain, which is like jumping and joy and like the little child brain, right? So it's like, oh my god, this fantastic and oh great time, da, 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 whatever. And then the other fellow is wise and is observant. He's quiet and he's telling you, like, okay, back off, watch it, he did this, he said this, see the body language, whatever, and we shush that brain, right? So instead
Sure.
of that, both these brains have to be talking to each other. This fellow is getting all excited and da, 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 whatever, accept that also, but also listen to this voice. So you can balance it out. How much of the I don't like list I'm allowing? I don't like if a person behaves this way, says this way, characteristics, whatever. In my list of, I will definitely not tolerate, maybe there are a couple of things, and I will adjust to some of these things which I don't really like. There will be a couple of things. Now, this person's behavior and body language and cues that you catch before you all go into something more intimate and private, are there any of these alarm bells and any of the red flags falling in the list of definitely I don't tolerate? If that is the thing, then forget about the good feelings that you have and take it slow. So it's not as if you cut out the person, but take it slow. Observe more. Take time over it. Maybe have a couple of little informal but not very intimate meetings first. So assess the person before you do something where you are totally vulnerable. Secondly, have these kind of benchmarks for you. This has happened, that has happened, that has happened. What is my tolerance limit beyond which I will not take? Thirdly, always when a person is like flying high and like, throwing a tantrum or whatever it is, your demeanor will have an effect on. If you present yourself as fearful, scared, also angry yourself, then it's going to be putting fuel in the fire. Instead of
Yes.
that, if you present a calm demeanor that you don't affect me, organize your physiology, your mind, your breath, your body, be in sync with it and breathe calmly to hold your own. And with good eye contact and calm voice, say whatever you have to say and have a strategy in place. Because like you said, like there is so much risk involved, because you like will be getting together with strangers, relative strangers at least, right? So have a strategy in place. If this happens, what do I do? Okay, so can I call someone? What are the protective measures that I can take for myself before it becomes too much?
Exactly.
Okay. I mean, this is what I can say offhand. I'm sure there are other ways of, handling these situations.
But you have said a lot, Sulbha. Thank you so much. I was listening and it really touched somewhere, As you rightly said,
Thank you. I'm glad.
One is that monkey brain who wants to fall in love and take him on a honeymoon. And the other person, Umang, you just met him today.
I know. Yeah, it happens. And I'll tell you honestly, I mean, you're talking about because of your own experiences and all. You're talking from the LGBTQ community and the dating sites and all. Exactly the same thing happens in hetero dating sites. Exactly the same. All right. So it's a human thing. Don't isolate yourself as, oh, I'm some other species and all. It's universal.
Okay, thank you. Is there any question? Maybe last question, if anybody has, because we've already passed our deadline of 5:30, and I had some to you, Sulbha. There's no lower of energy. You rushed all the way from Andheri. You did a session, and you are here, and still and there are two people who have raised hands. So you want to take 2-3 minutes break, and you can want to come.
No. I'm fine. I told you these are the advantages of ADD.
See, you're so positive, na? Instead of cribbing, ke mujhe it's lovely. What an attitude, Sulbha. Thank you. So there are two people have raised hands. Can you go ahead with your question? Go ahead.
Can I ask?
Yeah, go ahead.
Yeah. Ma'am, thank you for telling us how to handle a difficult situation. Other thing that I wanted to know, that supposing you have already made a mistake, and now how do you take it from there? Like, that you need to forgive yourself and you need to let go and you need to move on. But it is very easy to say that rather than, you keep on thinking that, what I find is that even if my intention is not bad, but if I end up making a mistake, then I spiral down,
Yeah. So because what do we tell ourselves? What do we tell ourselves when we make a mistake, and why do I spiral down? Why is it so difficult to forgive ourselves?
Because you feel responsible for that. Like, meri wajah se aisa hua.
ठीक है ना, you are responsible. Are you God? Even God makes mistakes, by the way. Are you God?
Yeah. No. Yeah.
So why are you responsible for the whole universe?
Right.
Now you tell me one thing. Suppose you and I are like having an interaction. We are like whatever, friends or whatever. And for some reason, I start shouting at you and I accuse you of things and whatever, right? Okay. And you get terribly angry and you cut me off. Okay. And then I feel this is very much unjustified or whatever, that's how it will go on. Right? Is that the only way in which you could have dealt with my accusations and anger outbursts and all? That you also become angry and you feel upset and you cut me off. Is that the only way?
No.
Right? What are the other ways that can be done?
In this situation, I would, if the other person is angry with me, I should keep quiet and I should try to be in the other person's shoe, that why that person is angry. Maybe something is not right. Maybe that's the thing. So I will respond calmly later on rather than reacting immediately.
Right.
And personalizing it, not personalize.
Correct.
Yeah.
Correct. So if you do that, then it's likely that you won't cut me off and therefore I will not become even more angry. And then sometime later, there is a chance that we can recuperate and then make mend, our ways. Right?
Right.
Yeah. So if I am angry and you do something, am I responsible for your behavior or you're responsible for your behavior?
If you are angry.
If I'm angry and I give you galis and whatever, and you react, one option is you react angrily. And the other option is that you can stay calm and handle the situation in a different way. Correct. Therefore, am I and my anger, my behavior responsible for your reaction, or you are responsible?
I am responsible for my reaction.
Correct. Then why are you responsible for everybody else?
Right. Right.
So we have to accept that maybe there is something off, something not okay in what I did. Maybe I have made a mistake. However, the other person still has a choice of being mature about it. Therefore, I won't be responsible for that person's behavior, but I will be responsible for my mistake, and I will see how I can make amends for it.
Right.
That's it. But I am not going to be responsible and feel guilty forever, as if like, there's nothing, like it is the thing that cannot ever happen.
Right. Yes, ma'am.
Okay. So what happens is this whole thing that if I make a mistake, then I can really not forgive myself. When we don't forgive ourselves, why don't we? Because the demand from ourselves is that we must be always perfect. Nothing should go wrong. Why? Because remember this, it comes from our childhood training. Our parents, mostly dominating, expecting, exacting, etc., are telling us, always pointing out and shouting if we make a mistake. So we learn, unfortunately, based on that if I make a mistake, I am horrible and I cannot forgive myself. But that script we can change, no?
Yes. Yes.
Right. So that was then. That was when I was a small child. My parents, for whatever their reasons, with all good intention, they said these things. But now I don't agree with it. Now I feel it's okay to make mistakes sometimes. Tell me one thing, if some of your friends, your colleagues, your family members were to make a mistake, would you be so rude and so unforgiving to them?
No, I will forgive them instantly. Yeah.
Okay, so this rule is only for you. You're very special. That I can't forgive myself is only for you, right?
Yeah.
Great.
Actually, ma'am, what happens
So
is that if I hurt somebody, I feel so bad that meri wajah se that person is feeling this way. So then I start blaming
the same
myself.
thing.
Yeah.
It's the same thing, na?
Yeah.
आपको hurt, सामने वाले को hurt होना है नहीं होना है, we depend on whom?
The other person. Yeah.
Exactly. So your behavior definitely has to change, if at all it can be changed, if for some reason. But say, for example, like how I was earlier demanding. You remember? So I used to feel like, oh, this, that, and I am feeling hurt because she didn't call me or whatever. But that person is going about her own life.
Yeah.
Maybe I wish that she would have called me, but she didn't. Right? But was her intention to purposefully ignore me? Maybe not. Maybe or maybe not. Right? But I decide to get hurt because I put meaning into it. Oh, she's doing this. If I don't matter, see how much I am invested, but this and that, and like full drama I make out of it. Right? And that's the reason why I get hurt. So what has to change? My approach to that incident has to change. And if at all I feel that in that person some change has to happen, I can hope and wish that that person realizes and changes. If at all there's an opportunity, I'll explain. And after that, it's up to him or her. No?
Yes.
The same thing is with you. If you have done something because of which someone has got hurt, responsibilities of that person to look after their own thoughts and moods, reactions. You can review what difference I can make in my approach, my behavior, whatever, because of which possibly it has led to that hurt. That is under your control. Now, how that person decides to view that incident and whether or not that person reviews it differently and decides to change mood depends on that person. At the most, if you all are close, you all can help each other. That's about it. Okay, but remember, if do unto others, but first do it unto you.
Yeah, right. Yeah.
Thank you, Sulbha, for really giving a step-by-step approach. And what really, like what you said, why that rule is applicable to you only, when you can forgive your friends, why not, why is it applicable? We are too harsh on ourselves. Yes.
Absolutely.
And sometimes we don't have any control of what the other person is behaving or thinking. You know?
Not at all. And remember, it's the parent in you talking. Oh my God, you this bad child, you are doing this and you're making this mistake and you're hurting this one and that one and that. Oh, you ought to get punished, and then we'll end up punishing ourselves. So that parent has to actually remember we are grown up. The parent in our head has to sit by the window in an armchair and aram se sip chai coffee. That's it. And the good nurturing parent can stay with us, by the way. The critical parent has to sit there. The good nurturing parent can hold hands and come with us.
Sulbha, now we will give you an opportunity to have chai, coffee. We'll come to an end to a lovely session. Can you please unmute and give a round of applause?
Thank you so much.
Her enthusiasm has not diminished a bit, you know. She's come all the way running from Andheri from 2 here at Thane at 4 and it's 6, but the enthusiasm, energy is same and the eagerness to help, you know, you can go on till I call it a shot. Thank you so much. Sulbha, I have
welcome.
2 things which have touched me. First of all, thank you for encouraging this initiative, mental health expert talking about their own mental health challenge. Thank you for opening your heart and doing what you're talking about. You know, when you are telling your patients to take help, medicine, you yourself are doing that. That is becoming a role model, you know. Thank you so much. And what you also said, that the change in mindset which is required, you know, see, as you said, my friend must behave that, my boyfriend must have, that we need to work on, you know, as you said, as you really, you know, poured your heart out that pehle mera friend oxygen tha, lekin now I need him, he's no more oxygen, you know. And if I am hurt, I need to talk in a nice way, not blame somebody, you know. And it's okay to accept that you are hurt, you know. Other thing powerful, you said that your mental disorder is not your identity, you know, it is just one aspect of yourself. And 1 in 4 people have that, you know. Focus on that, and especially your whole positive attitude about having all these challenges and making positive about it, you know.
Definitely.
Makes me energetic, pumped up, you know. All this is...
No, but honestly, like I'm telling you this, we need to trust nature. The nature creates all these things for us because we don't, you know, take charge of ourselves and do it ourselves. So all these disorders or whatever are nature's way of making us focus that like you need to introspect, you need to look at ourselves and take care of ourselves. That's it.
Thank you. And lastly, what you also explained, to pause and say, is if I have to reply like a child, adult, or the parent inside me, you know. That's so lovely, you know, because it really makes us pause. Do I really want to continue in my usual way or the new way? You know?
Yeah. And mind you, like, not that always a parent in us is, you know, punishing and critical and all. Often the parent, the one side of the parent is also very nurturing and supportive. Let that stay alive. Let the critical parent retire.
Thank you so much. We could have gone on, you know, but we'll take a break because it's been almost like 2 hours, you know. So thank you so much. And I remember having 4-hour sessions with you from 8 to 12 those days, you know, during pandemic. Thank you for that. So I think we'll have a physical meet also. It's been pending.
Sure, it will be nice. You know? Definitely.
Thank you for being here. And Sulbha has helped a lot of people from HCI pro bono. She's given references of people to do sessions and very accommodating. Thank you so much, Sulbha, again, for coming into my life.
Pleasure.
Ma'am, come
I really appreciate that you guys are talking about mental health and making it an ordinary everyday thing. So I really appreciate all this. Yeah.
Thank you.
Ma'am, come again.
Oh yes.
Yes, ma'am. Please come again.
Sure.
Ma'am,